Moving on to the muscles that act at the elbow and radioulnar joints. The upper arm can be divided up into two compartments, the flexor compartment and the extensor compartment. And within the flexor compartment we have the muscles of biceps brachii and brachialis, and in the extensor compartment we have triceps brachii and then a small slip of a muscle called anconeus. In addition to the flexors and extensors in the upper arm, there are other muscles that assist with the movements of flexion at the elbow. In particular, there is brachioradialis in the forearm and pronator teres. The muscles that produce the movements of pronation and supination are pronator teres and pronator quadratus, which obviously pronate the forearm, and the muscles that supinate the forearm are biceps brachii and supinator. Starting off with biceps brachii. Biceps brachii is a superficial muscle. It's a fairly long fusiform muscle that proximally attaches to via two tendons. The short head comes from the tip or the apex of the coracoid process. The long head has this rather tortuous route in which it passes up through the intertubercular sulcus, over the head of the humerus into a point known as the supraglenoid tubercle and the adjacent labrum. It's the course of the long head of biceps as it goes up and over the head of the humerus and underneath the coracoacromial arch that makes it prone to impingement. As it passes up to its proximal attachment, the long head of biceps is encased in a double layer of synovial membrane. Irritation of this synovial membrane is not at all uncommon. Distally, the biceps tendon itself runs down in between the two bones of the forearm, and it attaches onto the posterior half of the radial tuberosity. So here we can see biceps passing down in between the two bones, blending into the radial tuberosity there. There's the tendon passing between the two bones again into the radial tuberosity. But in addition to that, we have a sheet of aponeurotic tissue that goes off and blends with the fascia of the forearm. Biceps is obviously an elbow flexor, but it is also a very strong supinator of the forearm, and it also may assist with flexion of the shoulder via its short head in particular. Its nerve supply is via the musculocutaneous nerve roots C5 and C6. Deep to biceps, we have brachialis. Now, brachialis is a fairly large muscle. It's a fairly powerful elbow flexor. Covers the anterior aspect of the elbow joint and arises from the anterior aspect of the lower half of the humerus and adjacent into muscular septa. It's a very coarse, thick muscle, and the fibers converge to form a tendon that eventually inserts into the tuberosity of the ulna on the anterior aspect of the coronoid process. It's a strong flexor of the elbow. It's the primary elbow flexor, and again its nerve supply is predominantly via the musculocutaneous nerve C5 and C6, although the radial nerve may also innervate a portion, the lateral third or lateral half of the muscle may be innervated via the radial nerve. Coracobrachialis sits in the anterior compartment. It arises from the apex of the coracoid process again, and it goes off and attaches to the medial aspect of the humerus. Its function is as an adduct of the glenohumeral joint, but anatomically it often gets grouped in with the elbow flexors because of the common nerve supply and the common compartment that it shares. The musculocutaneous nerve itself passes through coracoid process, piercing this muscle. Brachioradialis is usually anatomically grouped in with the extensors of the wrist because it shares the same compartment and common nerve supply. Its attachment is via the upper 2/3 of the lateral supracondylar ridge. So we've got brachioradialis running down here. It inserts via a flat tendon onto the lateral surface of the styloid process of the radius. It acts as an elbow flexor, and it's most important when the arm is held in a mid-prone position. And its nerve supply is via the radial nerve roots C5 and C6. So we have three strong elbow flexors there: supinator, brachioradialis, and brachialis. Triceps, on the other hand, is a three-headed muscle on the posterior surface of the humerus. So here we can see triceps up here. So here's the posterior surface. Down here we've got deltoid, lat dorsi coming up and across, and there we can see triceps again, forming a broad, flat structure. It's got a long head that attaches to the infraglenoid tubercle on the scapula, and then a lateral head that attaches on the posterior surface of the humerus above the radial groove, and the medial head attaches to the posterior surface of the humerus below the radial groove. The three heads converge together, they wrap around over the back of the olecranon process and insert onto the posterior surface of the olecranon process, forming this broad, flat tendon. Its primary function is obviously as an extensor of the elbow. And its nerve supply is via the radial nerve C7 and C8. There is a small triangular muscle on the posterior surface called anconeus. We can see anconeus here that arises from the posterior aspect of the lateral condyle or epicondyle of the humerus. Fibers insert onto the side of the olecranon process, blending in to the tendon of triceps. Again, it's a weak extensor, it's a small muscle, so it's a weak extensor of the elbow, and its nerve supply is via the radial nerve C7 and C8. Moving down into the forearm, the muscles that produce the movement of pronation. Here we've got the medial epicondyle over here, so we've got all our muscles coming off the medial epicondyle. Here we can see the brachioradialis muscle that we mentioned earlier. Okay, and over here we've got pronator teres coming obliquely across. Pronator teres has two heads. It has a humeral head, which arises from the common flexor origin, so the medial epicondyle of the humerus and the medial collateral ligament, and it has an ulnar head that arises from the medial border of the coronoid process. The two heads converge together and they pass obliquely downwards and laterally across the forearm to insert onto a roughened area halfway down the radius. It is a powerful pronator of the forearm. It's a short, thick, very solid muscle, and its nerve supply is via the median nerve. Pronator teres is assisted by this small slip of a muscle. So here's pronator quadratus, and it basically passes from the anterior surface of the lower quarter of the ulna across the anterior surface of the lower quarter of the radius. It's a square muscle, very thin, it's not particularly strong. Its function is probably most important as a stabilizer of the forearm bones rather than an actual pronator. Again, its nerve supply is via the anterior interosseous branch of the median nerve, C8 and T1. Going around the back, here we can see supinator that assists biceps in producing the supination of the forearm. Again, it has two heads. The humeral head, which arises from the common extensor origin, so the lateral epicondyle and lateral collateral ligament, and also partly from the annular ligament. And then it has an ulnar head that attaches onto a crest called the supinator crest here on the lateral aspect of the ulna itself. The two heads converge together and they wrap themselves around the radius before inserting onto the anterior and lateral surfaces of the shaft of the radius itself. Again, it's a powerful supinator of the forearm. It works in synergy with biceps to produce this very strong movement of supination as a force couple. Its nerve supply is via the posterior interosseous branch of the radial nerve, C5 and C6.